Good afternoon, everyone. We will give everyone a few minutes to come all in before we start, and then we will get started. Okay, so good afternoon, everyone, and thank you for attending our webinar today. There are a few things to remember before we get started. This webinar will be recorded. Your microphone and camera will be turned off for the duration of the webinar. And to ensure accessibility, live captions can be enabled from the control panel. So my name is Carlene Stobie, and I am a knowledge translation specialist with the National Collaborating Center for Methods and Tools, and I will be your facilitator today, and Alana Miller will be our support. We have a wonderful presentation for you today on the Social Media Crisis Communication Guidebook, which will be presented by Dr. Melissa McKay and Dr. Kevin Parent. High levels of uncertainty result from emerging infectious diseases like COVID-19, creating unique communication challenges that are different from other health communication initiatives. Effective crisis communication is essential to promote the recommended prevention behaviors, such as physical distancing, hand hygiene, mask wearing, and vaccination, and to maintain trust during the crisis. This session will provide an overview of best practices for social media crisis communication for public health and its practical application during COVID-19. First, the best practices for effective crisis communication to demonstrate trustworthiness will be presented. The Guidebook for Social Media Crisis Communication has been widely shared and downloaded, providing practical advice for public health. Next, Ottawa Public Health social media crisis communication during COVID-19 will be explored to highlight the lessons learned and key strategies the team employs. Ottawa's public health Twitter account is the most followed local public health account in North America, and their social media throughout the COVID-19 pandemic has been lauded for its excellence in organizations like the Public Health Agency of Canada, the World Health Organization, the Rockefeller Foundation, and many others. Before we begin, I have our land acknowledgement and a few housekeeping comments. So the NCCMT is hosted at McMaster University in Hamilton, Ontario, which is located at the traditional territories of the Mississaugas and the Haudenosaunee Nations, and within the land protected by Dishwa's Wampum Agreement. We would also like to acknowledge the land from our fellow presenters. The University of Guelph resides on the treaty lands and territories of the Mississaugas of the Credit, and the University of Ottawa on the Algonquin Nation. So a few housekeeping comments to keep in mind. We recommend using a wired internet connection for today's webinar. For best results, if possible, use the latest version of Google and Firefox internet browsers. If you do have any technical difficulties, please send a private message to Alana Miller, NCCMT, and we will be able to respond to those requests. If you have any questions for the presenters today throughout the webinar, please send them to the Q&A, and we will make sure to get to those at the end of the webinar. There will be a few polling questions today in the webinar. When they open, they will pop up over the slide. Please note there will be a slight delay in the polling questions. Once you enter your response, please press submit. After today, the slides and recording will be available in about 2 weeks' time. The recording will be posted on our YouTube account, and the slides will be posted on our SlideShare account. We will also send out tweets when they are posted, so keep an eye out for our Twitter at NCCMT. So we have our first polling questions for you today. You should see it pop up on your screen shortly, so just make sure to answer those questions and press submit. Just gonna give everyone some time to get those answers in. So the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers across Canada. We are hosted at McMaster University in Hamilton, Ontario, and our goal is to support public health professionals and organizations integrate evidence-informed decision-making into their work. The National Collaborating Centers are funded by the Public Health Agency of Canada. We each focus on different priority public health topics. From the West, there's a National Collaborating Center for Indigenous Health in Prince George, British Columbia, the National Collaborating Center for Environmental Health in Vancouver, British Columbia, the National Collaborating Center for Infectious Disease in Winnipeg, Manitoba, the National Collaborating Center for Public Health Policy in Montreal, Quebec, and the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. At the NCCMT, we have many products and services to support public health professionals in engaging evidence-informed decision-making. This includes a registry of methods and tools with over 270 methods and tools, online learning opportunities, including our 13 online learning modules, workshops, Public Health Plus, which is a repository of public health research, video series, including our Understanding Research Evidence videos, which go through concepts important to research in short and easy to understand videos, and also networking and outreach events. So without further ado, we have our presenters today. Our first presenter today will be Dr. Melissa McKay. She's a postdoctoral scholar and sessional instructor for the Masters of Public Health program at the University of Guelph. Her research focuses on effective health and crisis communication with a specific focus on social media. And then our second presenter will be Dr. Kevin Parent, who has been the social media lead for Ottawa Public Health since 2008. He graduated from Carleton University with a major in communications and a minor in sociology. He has 3 kids and is those are the reasons why he loves coffee. So right now I will stop sharing my screen, and Dr. Melissa McKay, you can start sharing yours.
Hello, everybody. Sorry, I'm just getting my slides up. Just give me a moment. All right, I think. Can everybody see my slides and hear me okay?
Yes, you're good, Melissa.
All right, thanks so much for confirming. So thanks so much for being here. What an excellent turnout. I hope the sun is shining where you're at. So as Alana mentioned, I'm going to kind of go over some of the best practices that are part of the Social Media Crisis Communication Guidebook, and I'll provide a link to it in a second. And then I'm really looking forward to hearing from Kevin and learning, from the Ottawa Public Health and what they did, as I'm sure you did. I followed closely throughout the pandemic. So thanks again for joining us today. So overall, I am going to provide you sort of with the evidence, kind of like an introduction broadly to crisis communication, why it's important, and some of that key evidence and tools that you can use to help you hopefully effectively design crisis communication for social media. So communicating in a crisis is different than other types of health communication. High levels of uncertainty result from new and unfamiliar risks like COVID-19. And as you know, during a crisis, people have a lot of fear, they're highly stressed, and so they're processing information differently, they're taking it in differently, and then they're also acting on it differently. And some of those differences do relate to the fear that we're feeling, and how that actually impacts our ability to process, very complex information. But also within sort of the overall kind of communication landscape, within our highly connected society, we're being exposed to massive amounts of information. And as you know, some of it's factual, but a lot of it's false and or deliberately misleading. So our ability to kind of cut through all that noise really relies on the trust that we have, with our communities and our ability to effectively communicate. So false information was incredibly abundant throughout, especially the first waves of the pandemic. So here is an example early in the pandemic of Dr. Henry in BC, taking a helicopter surface with claims that she was just visiting her family and totally violating her own guidelines on non-essential travel. The quote, "Do as I say, not as I do," was shared widely. It wasn't true. She was actually going home after a briefing in Vancouver. But it just created this environment that was ripe for misinformation, including, other rumors, like the fake stay-at-home order that you see on the bottom left-hand side of your screen. So all this is undermining the public health response and the trust that we have with our communities. So crisis communication specifically is audience-centered, and it's occurring as part of like an overall crisis sort of management response, where different measures are put into place to either mitigate or prevent harm altogether. And the important thing is largely based within uncertainty about the hazard. So in our case, specifically COVID-19 would be an example of a hazard. And trust is a fundamental outcome of effective crisis communication and is directly impacting the public's perception of their risk, of how effectively we're communicating, and whether or not they're going to follow our advice. And transparency and consistency in particular are extremely important aspects of communicating uncertainty, where we're sharing what we know and, really importantly, what we don't know, regularly and consistently as well. So here's some more examples of conflicting messages and how people reacted to changing recommendations. And this was widespread, especially in Ontario, as I'm sure many of you are aware. So this was a stay-at-home order that read, only leave home for essential purposes. And you can see in the frustration from the tweets that I've posted that people, were out doing things and were, frustrated and didn't understand the stay-at-home order. And partly, we were never aware of the sort of thresholds for the various levels of mandates. They were never transparent, and that did create a lot of confusion and distrust. So there's assumption that skepticism or even mis and distrust towards science or public health is a result of a lack of information, and that if we can just kind of provide more information to the public, they're going to follow our advice. But like I previously mentioned, we have so much information, especially in our globalized society, from a huge number of speakers. So actually, I think the issue is that people are questioning the trustworthiness of science, of public health, of government, of vaccine manufacturers, etc. Not because we're not providing enough information, but because in part we're not effectively communicating. So we need to be able to demonstrate our competence, our willingness to act in the best interests of the public through detailed, creative, honest, and really balanced communication. So I thought this was a really interesting study done in 2022. So on the left, you can see the perception of the effectiveness of government action. And then on the right, it's compliance with public health guidelines during COVID-19. So you can see both show 5 points in time over COVID, and both perceptions of government response, perceptions of the effectiveness of the government response and compliance with public health measures all significantly decreased over these 5 time points. And many factors are influencing people's perceptions of effectiveness, but in part, public health communication and government communication is contributing to this decline. So the issue of trust, or even distrust and mistrust, is central. And effective communication can demonstrate, the mechanisms of which we're, trustworthiness is shown. That can be through representing shared values, our expertise, our competence, showing concern, and really importantly, being transparent and consistent. A quick search on Twitter with the keywords trust and COVID vaccine in Canada showed an incredible number of tweets. And you can see specifically with the COVID vaccine, hesitancy was fueled by distrust. And that was in part due to lack of effective communication on our part that really met, the needs and the values of our communities. So effective crisis communication can save lives, and trust is an extremely important outcome of our communication because, like I said earlier, it's influencing risk perception and it's impacting whether or not people are actually going to engage in the behaviors that we're recommending. But we're competing against so many, other spokespersons, media, celebrities, influencers, and conspiracy theories and others, especially online, for their attention. So we need a really coordinated and transparent approach to our communication. It's really, better matched and much more nuanced in order to meet the needs of our communities and overcome, all that mis and disinformation that's out there. Okay, so the guidebook outlines a 4-step approach to draft crisis messages that are audience focused, they're evidence-based, and they provide sort of feedback into that process where you're better understanding how to increase engagement and the positive response to your messages. So there's so much more detail in the guidebook, so you can download it. There was a link at the beginning and there's a link at the end as well. Perhaps maybe someone could throw it in the chat if they have it handy as well. So please, you can reference that in the future as well. Okay, so the first step is to conduct audience segmentation. So we know our audience are judging our crisis messages based on the content within them, the messenger, or in other words, the spokesperson, so who's providing the message, and the channel that's being used. So, with that said, it's really important that we understand the information preferences, including the channels that are preferred in order to, increase our message reach and the impact of the messages. So we often use demographics in public health, such as, age, gender, income level, education, etc. But audience segmentation involves dividing sort of larger audiences into subgroups based on other similarities, such as behaviors that they engage in or not, needs, opinions, shared values, and even the social determinants of health. So this is really helping to support the development of crisis messages that are more suited to our different communities' needs and their values, and then, is thus much more likely to result in behavior change. And messages that are more, matched to different communities' needs are also much more likely to have organic spread within social networks. So working together with subpopulations or communities is a best practice of crisis communication to try to be able to co-create crisis messages, create shared decisions, shared values. So the one-way push model of sort of creating one-size-fits-all messages and pushing it out on all the communication channels that we may use isn't meeting the needs of all of our community members. So involving groups wherever you can to better understand their needs and provide more nuanced information that's matched to their preferences, to their information needs and gaps is essential. So one thing also to consider to better tailor your messages to different communities is to partner with trusted spokespersons. These might be influencers on social media, which I'm sure Kevin might talk a little bit more about in his part, physicians, faith leaders, those that are part of different ethnic communities, and sometimes even celebrities. So, it's important to work with different communities to understand who they have trusted and authentic relationships with. And, you can use your engagement sort of just to signal to you whether or not people are taking in your content. So whether or not they're sort of interacting with the crisis messages that you're putting out. And those same sort of metrics then are perceived by other people as the opinions sort of shared by others. So partnering with people that are trusted and have really authentic, strong communities on social media can really help with that higher engagement. So next you're going to use what we call guiding principles or best practices is another way you could think about it. And these guiding principles are really important because they're helping to demonstrate our trustworthiness. And some of them are important for social media as well. So these, I have 2 polls coming up. So take note of these and sort of the brief definitions because we're going to make some guesses on which of these a couple of social media posts have included. Okay, so call to action is simple. It just asks someone to do something like click a link, for example. Clarity is ensuring that you're using, the appropriate language, but also that you're targeting and tailoring information to different communities. Compassion and empathy is really important to show our communities, that we care, that we understand that they are facing challenges and that we're working to help them overcome those challenges. Correcting misinformation is a really important way to directly address rumors, myths, conspiracy theories that are circulating sort of within the communities that you serve. And then transparency is a really, really important guiding principle for demonstrating trustworthiness. So as I mentioned earlier, it's sort of that balanced communication, sharing what we know currently and what we don't know, and how we're going to go about finding that information out. So it's giving more detailed information about how we're making decisions, what evidence and information, we're making decisions on. And it's priming communities to understand that those recommendations may change as the science evolves. So these guiding principles are interrelated and sort of function together to demonstrate trustworthiness. And in some research that we conducted on Twitter, we found that, increasing combinations of these guiding principles, so if you use 3 or 4 or 5 or 6, the odds of people actually responding positively within the comments to those posts goes up as the combinations of guiding principles go up. Okay, so this is going to be our first poll. So as I mentioned, take a look at this post, both the graphic and the caption, and see which guiding principles you think are represented here. So we'll just pause and give you a second to do that. Are you able to share some results from this poll? I think, Alana, you're running the polls. Oh, there we go. Okay, thanks. All right, good job. So yeah, this post used call to action. So there's a link for more information. It used clarity, mainly in the way that it's sort of using more friendly sort of tone with the language, but it's also a little bit tailored towards parents as well. It also used compassion and empathy. So it's saying, we understand how difficult working from home, taking care of your children, etc. is. And there's also conversational tone, which again is that sort of balance of friendly and professional language. And then it did not use correction of misinformation, and there's no transparency in this post. So to be more transparent, perhaps the post could have let us know a little bit more about the survey that they're asking parents to complete, why they're doing it, and to what end, for what purpose. Okay, we're going to do this one more time. So take a look at this post and see if you can take some guesses about which guiding principles are represented. Okay, if you don't mind bringing up some results, that would be excellent. Okay, so this post has call to action. So there's a link for more information, conversational tone, so there's contractions, and that sort of balance of friendly language and using first and second person, and transparency. So we rarely actually found transparency within the research that we did on social media crisis messages. but this one's a great example. So it's shown here by clearly indicating that the research is ongoing and that things may change, but based on the best available evidence that they had at the time, that COVID can live on surfaces for a long time. There's this direct request to clean often and lots more information in an infographic style to help people learn more. So there's that balanced information and cueing, the follower that evidence may change in the future, sort of depending on what we learn. Okay, so we can also use theory in combination sort of with those guiding principles to help develop crisis messages that are going to more directly influence behavior. So within the guidebook, we talk more in detail about health belief model, which you're probably most familiar with, but also the extended parallel processing model. So I'm going to focus on the second, the extended parallel processing model. You don't need to remember the name, but basically what this model says is that crisis messages should provide information about the threat, which is the combination of severity information and susceptibility information about in our case, COVID-19, but about the disease or the threat, and then cues to action and efficacy information. So just quickly, severity is information about the health and or social consequences of the disease. Susceptibility is information that shows people they're vulnerable. This could be things like number of deaths, variants within the community, how quickly they're spreading within, a certain subpopulation. And cues to action and efficacy are prompts for individuals to engage in a behavior. So maybe like steps that you take or reminders, and information that helps people feel like they actually know how to engage in that behavior. So for example, how to actually sign up, for their immunization. So what exact, steps do I need to take? What link do I need to follow? How do I get help if I need it? So really importantly, when crisis messages have high threat and high efficacy and cues to action, people are much more likely to actually engage in the recommended behavior. But if the threat's low or efficacy and cues to action are low, then people either respond defensively or they reject and ignore the message altogether. Okay, so like we did with the guiding principles, here is a post from Instagram. So we'll put the poll up and you're going to assess from that extended parallel processing model, whether or not it has severity, susceptibility, efficacy, and cues to action. Okay, can we throw up the results, please? Okay, great. So this post included information about the threat, so severity and susceptibility, but no real cues to action or self-efficacy information. So, I think to include that sort of efficacy information or even cues to action, Science Sam could have maybe posted a photo of her, staying at home or maybe masked to more closely sort of support the message that she was delivering. Okay, so let's do that with one more. Okay, sorry, I know I'm going through the polls sort of fast, but I think we'll get the idea. If we could pull up the results. Okay, excellent. So this post had strong severity and susceptibility information, as well as cues to action and efficacy information. So the severity information is communicated in the line, even young and healthy people can get really sick from COVID. So it's like that, communicating that you can get really sick. And then the susceptibility information in the right now, 20 to 29-year-olds have the highest infection rates. So that's communicating sort of along the line of what's happening in a certain community. And then the cues to action are really strong in this post through the actions that they're recommending, like hand washing, physical distancing, etc. So this is a great example of using sort of that full model across the post. Okay, so our research that looked at social media crisis messages for the use of guiding principles found that they are related to followers or our community's emotional response to the messages. So as I mentioned earlier, we conducted research on Twitter, and we found that increasing combinations of those guiding principles were associated with higher likelihood of positive message response. So that's really excellent. And then also research that we did on Instagram by quite a lot of different accounts across public health, government, politicians, and even science communicators and brand influencers found that posts that included information about the threat, as well as the cues to action and efficacy, were really also associated with significantly higher positive sentiment. And I'll explain a little bit more about sentiment analysis in a second. Okay, so we know public health audiences are highly segmented, and our selection of which platforms we're using for who and why we're using them should really reflect this. I do acknowledge that a highly segmented approach to public health communication may be difficult for lots of different reasons. So a layered approach where messages intended sort of for general public or the whole communities in which you serve can be used in combination with a more segmented approach where you identify there's different needs in various communities. So we really need to use the social aspects of social media to connect with communities, to foster connection between our followers, but importantly also between us as public health and our followers. And responding to comments and questions within the comment section or within direct messages is a really important way to foster this connection, provide relevant information, address any misinformation that's happening, and ultimately sort of work towards fostering trust. So that research that I mentioned on Instagram, this is a really busy graph, but this shows the average engagement rate across all these different sort of influencers or accounts that we looked at on Instagram and their COVID-19 posts. And engagement rate is a really simple calculation. It just shows you if your content's actually resonating with your followers. In this case, we just calculated it by adding comments, shares, all the ways people engage with your content, and dividing that by the number of followers. So in 2020, when this research occurred, or when the majority of it did, the average post engagement rate was about 2%. Let's see if I can find my pointer here. So right around this first line here. And you can see that news media, public health, and government sort of all had lower than average post engagement rate, while other groups like politicians, science communicators here, and then social media influencers specifically had much higher than average engagement. So it just really shows us when we look at our engagement rate, if our followers find our content meaningful and interesting, and if it's more likely to sort of spread organically through networks. So the last step is to make sure you're monitoring and evaluating your efforts. So I'm actually at the Canadian Immunization Conference right now in Ottawa, and I was at a great session this morning from Immunize BC, and they were talking about how they use social listening. And one of the examples that they used was really closely following the mentions within Hootsuite, which is a tool you may be familiar with, but it's kind of a platform where you can coordinate all your social media communication. But through monitoring closely, they realized a really specific question was being asked on social media over and over and over by people that live in BC, and that was, can I use cannabis and get my vaccine? And this question wasn't coming through any of their call lines, not through their public health nursing efforts, not through their actual immunization program. So they were able to use that sort of social listening to identify specific community needs and then create posts for that. So I thought that was a really great example. So two things I want to just sort of touch on before I wrap up is engagement metrics and sentiment analysis. So sentiment analysis is a tool that you can use through, Hootsuite or Buffer or Google Analytics, different sort of platforms that you're using. But it really easily tells you the emotional response people are having within the comments on your social media posts. And you can monitor sentiment to kind of develop a better understanding of what people are more positively responding to, or what types of messages, what combinations of images and the framing of messages people are enjoying. And something to keep in mind is that negative comments on social media posts, even single comments, that they attract a lot of attention from others, and they persuade others to also view your social media posts in a negative light. So it's important that we're sort of addressing that and trying to create social media posts that are having more positive sentiment or more positive emotional response. And then the other one is the engagement metrics. So that's likes, shares, retweets, comments, etc. So as I mentioned earlier, it's just showing you sort of how actively involved people are with your content. And the reason why that's important is because people are using this engagement information to actually evaluate your crisis content that they're seeing on social media. And it's influencing not only their attitudes towards that specific post, but also the source. So it's having, a direct impact on the confidence that your followers are having on you if there's a lot of negative engagement. So overall, just understanding and incorporating aspects of messages that are increasing positive sentiment in the comments, increasing engagement is really going to increase overall the reach and the positive impact that you can have with your crisis communication. So just a quick acknowledgement that the research that went into creating the guidebook was funded by SSHRC, and we had an awesome team of researchers from the University of Guelph, from the Canadian Public Health Association, and from the National Collaborating Center for Methods and Tools. So thank you so much to them. This is the link to the guidebook and my email, so I'd love to hear from you if you wanted to reach out. All right, Kevin, I believe it's your turn.
Thank you very much. Appreciate that. I am now just going to go through this wonderful sharing of screen situation. And there we go. So can everybody see just a slide that says engagement and everything and all that wonderfulness?
It looks great.
Perfect. Awesome. So thank you very much. I'm exceptionally humbled to be here and to be a part of this. I still find it immensely flattering that anybody wants to hear from a municipal government social media account. But yeah, as was said earlier, we gained a good amount of recognition over the last couple of years, just through our approach to communications, which is something that we kind of took our own unique take on even before COVID, and it essentially really focuses on this entire notion of engagement. This idea that it really does not matter how good your social media post is if nobody's paying attention. Like you can have just the most perfectly well-crafted message possible, but if somebody scrolls right past it, then what was the point? So everything we do is focused on engagement. We take a very audience first approach to social media. We do a lot of listening. We read all the comments and the replies. We try to cater our messaging to our audience and follow their needs. So what I'd love to do is I've got a few examples and just some slides to go through. I'm going to walk you through some examples of the way that we try to focus on engagement by catering to our unique audiences, especially being a government town in Ottawa. The ways that we do a lot of social media listening, the evolution of some of our pandemic communications, and then yes, we're going to talk about how the heck Ryan Reynolds became our spokesperson. So kind of one of the first lessons of this stuff for us was really this entire notion of like, you really have to stop and take your ego out of the equation if you're going to be getting into this world. People have given us a lot of recognition, and we love and adore it. But at the end of the day, this really, sorry, I'm pointing here as if you're with me because my screen's on my side, but you know what I mean. This is really what being a social media person during a time of crisis looks like, especially during a health crisis. This was a selfie I sent to my wife at 10:30 p.m. on a Sunday evening. I had worked until midnight the Friday night. I was at the office for about 15 hours on the Saturday, and then was there about another 15 hours on Sunday. This was about mid-March, like about the 15th, 16th of March in 2020. I had been trying to leave, and then the Ottawa airport reached out and said they needed messaging to put up on their screens, because this was kind of that environment that we were in, early in the pandemic. And this is the reality of what it looks like, trying to actually get out there and make this message happen. And, it's also just kind of that level of commitment that you end up with, the way that you just sort of immerse yourself in the messaging, because, we all really do care. We genuinely do care about, the people that follow us and trying to take care of people's well-being. And it's that caring that really kind of shines through in what we try to do. This is one of my favorite quotes from Ed Young. He's writer for The Atlantic. Everybody knows him. And this really is kind of that general sentiment that we try to get across of like, listen, like, the last few years have been probably one of the most difficult times that anybody's been through. And there's been a lot of shifting information and evolving evidence. And we're just trying to help people understand the world that they're navigating versus just saying like, hey, this is what's going on, this is what you should do. So kind of dive into it. I mean, one of the first things that we kind of discuss, for lack of any better way to say it, we have a really unique view of social media compared to a lot of groups that we've talked about this with, where you often hear people say that, well, that's social media, but this is the real world. We've all heard that phrase before, right? Oh, that was on Facebook, but this is the real world. We truly believe that social media is not some separate world. It's not some separate world that has to be treated differently than this. It's just a method of communication. It's just a tool. For those that are aware, like Twitter in its infancy was like a Microsoft Teams, like a Cisco Jabber. It was just an instant messaging platform. And at the end of the day, as much as it's now grown into this really interesting place it is lately, that's all it is. You have something to say, you say it. If people would like to listen to it, they do. If people want to say something back to you, they do. It's just a communications channel. And traditional large-scale communications, it's approached as broadcasting, right? And broadcasting being that classic agrarian word, you cast your seed as broadly as you can about a field. And that's usually the way it was approached, especially by large organizations, government institutions, and whatnot. Spend an incredible amount of time crafting, the one message, and then you send it off and you move on to the next. Well, with our approach to social media, it's always been, we put a lot of work into our messaging, but the bulk of our work actually starts after the message goes. Once the message goes out, then we're in there, we're reading replies, we're reading comments, we're looking at sentiments, we're trying to get a feel for how this is landing so that we can actually have that two-way dialogue. Because as much as social media is a broadcasting tool, you've got these huge audiences, it also has the ability to actually have just little intimate moments between you and one follower, you and one member of the community. And it kind of brings it together that way. So when we are crafting our messages, we're always trying to find a way to get people's attention. As we said, social media is a very fast place. You ever watch people out there? I mean, they're scrolling away like crazy, and you just have to find a way to get a message that's going to stand out. So there's a lot of different ways you can do that, and especially with communicating during a health crisis or whatnot. There's times where it's like you need to address a fairly important issue, but your social media post is really just that attention grabber. You know, you can get them to go off to a website where they can get the more fulsome information, but you have to grab that attention first. And there's a lot of ways we do it. We use humor quite a bit. It's something that we have become known for. But the thing with our humor is that we're just a bunch of nerds. Like, we're a government town, so we make government town jokes. Like, this post absolutely blew up and did exceptionally well. And at the end of the day, it was kind of a debunking deconstruction of a really common myth at the time that, you know, COVID was this big giant conspiracy and whatnot. So what we were doing is we were highlighting the very obvious absurdity of that notion, because anybody that's ever, like, my goodness, people, we gave you the Phoenix pay system, we're the government. Like, this conspiracies and doing this whole thing is not our thing. But it was that way of, let's grab something that people are going to take and that people are going to share. You know, our goal is always to drum up that engagement and get people to share the post. Because one of the fun things that happens on social is there's kind of like a, for lack of a better way to put it, an ownership. Okay. If I tweet something, you know, or if OPH tweets something, right? Like, that's our post, our profile pictures, our logo. People know that it's ours. But if Melissa grabs it and retweets it, what she's now doing is she's taking that post and looking at everybody that follows her and saying, okay, I want you to see this. You know, yeah, it's their post, but I want you to see it. And we are naturally so much more trusting of people that we know and people that we're close to. So your goal with these things is always drum up that engagement, find something that's going to resonate with your audience, and then let it run. And sometimes it's just a matter of just having a little fun with it. I mean, this again was something that was probably one of the first times we ever really did a full-on clap back at the people that were after us in our mentions. But again, it was just, I mean, yes, there's a public health message in there. It's about safe sex, great. But it's also just a way to really get people talking and get people to mix it up in your comments and mix it up in your replies and bait up engagement. You can also do that by knowing your audience well enough to know something that's always going to land. Like, again, we're in Ottawa. There was no world where this post was not going to take off. And yes, we did post that at 9:44 in the morning after the Leafs had been eliminated from the playoffs. So it was just a simple matter of being nimble, recognizing the mood of the moment, seeing what people were talking about, and getting up there and mixing it up in that space. The health message in this post is so short and so simple. It's just, yes, COVID's still out there. You can click on the link, you can go find more. There was a lot of risk and harm reduction messaging on that website at the time. That website doesn't exist. But it was a matter of just grabbing people's attention and then delivering a message. And then it's so important to be listening to them as much as possible. I'm about to fully date myself with a ridiculously old pop culture message, pop culture reference, sorry. If anyone knows this scene from the show Friends, 90s sitcom classic, right? So this was the scene where two characters on the show, Monica and Chandler, had just sort of hooked up, you know. And one of the reasons why this scene is so important to me as a communicator is that it's one of my favorite lessons ever. The fun story with this is that in the original scripts that they had planned for that season, these two were going to hook up, and then later on they were going to come back to it with a, like, you know, there's now going to be some awkwardness and whatnot, and they're two friends who have slept together and all the drama that goes along with it. But when the episode was filmed in front of the live audience, the audience went crazy. When she comes out from under the sheets. It's this fun little thing. The audience went crazy for 27 straight seconds. It was 27 uninterrupted seconds of the audience screaming at the top of their lungs. The writers actually then pivoted and changed the entire storyline for the seasons that followed. And this couple getting together and staying together and then eventually getting married became probably the defining story arc for the final few seasons of the show. And it really is such an important lesson in the value of listening to your audience. Your audience is going to tell you what they need, and they're going to tell you what they want and the things that they care about. And you have to be able to speak to them where they are. This post remains pinned to our Twitter page and has been for over 2 years just because of that. You know, we had done so much listening, and so many of us were saying that a lot of people were in just a very dark place and going through a lot. And so we stepped up and we met our audience where they were, because we are always trying as hard as we possibly can to listen to them and to just kind of address the things that they're looking for. Earlier in the pandemic, this is another example of that, where we had masks have just become mandatory. We had a couple of DMs in our account that morning from people saying that they'd witnessed some hostility. CTV and CBC both reached out to our media relations team, and they'd heard of incidents and whatnot. So we pivoted as quickly as we could. It took us about an hour, and we put a message together, got it translated, approved, and out the door. And I mean, there's nothing cheeky and fun about that. There's no clever joke. There's no nothing, but it was exactly what people needed to hear at that time. And that's why it resonated very well. It blew up incredibly well. It got about 15,000 likes on Twitter. But it was just that matter of like, the magic recipe there was just, you have to listen. You have to listen to your audience, and you have to think about exactly where they are and where they're coming from, which is where our threads came. We became known for our long form Twitter threads throughout the course of the pandemic, which is interesting because, from every standpoint, they shouldn't have worked. A thread is the antithesis to Twitter. Twitter is supposed to be just quick and fast paced. And here we are writing these, big, long 7, 8, 9, 10, 11, 14 tweet long threads. But they worked because they were a moment of candor between us and our audience. And they were born out of a really simple realization. Okay, when mandatory masks came out back in the summer of 2020, we saw a lot of confusion from members of the public saying like, wait a minute, I thought you said not to wear masks, and now you're saying to wear masks, and now you're mandatory and whatnot. And we realized that we as communicators had to recognize that we are in a different place from our audience. We attend every meeting, see every briefing note, see every document. We're involved in all the massive email chains and all that. So for us, the progression of the messaging over the course of those few months made perfect sense. But to the people out there that maybe didn't see every interview that our medical officer of health, Dr. Etchell, gave, or maybe hadn't seen every one of our tweets, or hadn't read every story, to them there were gaps in the knowledge. And at the time that gap was asymptomatic transmission, right? Because the messaging at the time was, don't wear a mask to protect yourself from others. But then once asymptomatic transmission was confirmed, it's okay, please wear a mask, but it's not to protect yourself from others, it's protect others from you. And getting that entire nuance out in 280 characters is almost impossible. So we went to threads. And if you get into some of these, you'll see things like us openly acknowledging that it seems like the messaging jumped around. Things like saying, we are sorry. We're sorry this is frustrating. We're sorry this is difficult. Those moments of vulnerability and those moments of a large organization stepping up and being like, we don't know the answer to this question, or we are sorry about this situation. To a comms person, yeah, that's following the best practice. Goodness, John Rainford, Peter Sandman, like pick your crisis communications theorist, or even, the guidebook that we just saw, and it talks about how important empathy and humanity is. But for a large organization to actually go out and say words like, we're sorry, that was quite unheard of at the time. And it ironically set up a lot of, I'm just realizing that I may have been looking at my presenter view versus other ones, so I've probably been on the wrong slide for a lot of you, but it's okay. And that's the least silly thing that I've done so far in this entire anyway. And so, when you get into like some of the messaging here, so this post really went out to do nothing more than deliver the message that you can see in the top right there. At the time we were trying to talk to people about the importance of why is there a difference between what's recommended versus what's allowed. Coming into that first Christmas of the pandemic, when the public health messaging at the time was only gather with people from your household, but you were allowed a 25-person gathering. And so I was trying to walk people through that logic of, yes, just because something is allowed doesn't actually mean it's necessarily the right thing to do. And the analogy we came up with was driving on the highway. The speed limit's 100, but you shouldn't be doing 100 if there's a blizzard. So again, it's all just sort of taking that, the stuff we talked about at the start of speaking to people like they're humans, speaking to people like they're genuine, and finding ways to meet your audience exactly where they're at, which is exactly how, the story of Bruce came to be. It's probably one of the defining moments of our pandemic communications, and it genuinely came from just taking everything we'd been doing already and applying it to something new. So the backstory of Bruce, because everyone always asks. The backstory, Bruce, is that the Super Bowl tweet was nothing more or less than a bait of engagement. We've talked about ways to get engagement by knowing your audience and knowing what's going to resonate with them. We've talked about ways to get engagement by listening to your audience and knowing where they're at. And then sometimes you can just shamelessly create, such as something like this. This is actually one of the first times that we'd done this tactic. This was a really fun and simple little sexual health tweet. Again, lots of evidence out there into the effectiveness of using humor when communicating about sexual health, because it kind of breaks down the stigma and makes it more approachable. But the fun thing with this was the chapter. Like, you all know exactly the first comments that rolled in on this post. Every single person on Facebook, Twitter, Instagram were immediately coming after us being like, oh, I think you missed it by one. And it's like, no, you just fell for it. And it was just that opportunity of like, well, we're going to blatantly bait people into engaging with us. And then we're gonna use that as opportunities to mix it up in the replies and build some rapport and build some relationships and make it human and personable. And that's exactly what this was. This post that was written a few days before it went out, that's all it was. This post was designed to make people reply and say, you had one job, Bruce. And fun fact, the original iteration didn't have a name. And then we're like, it's got to have a name. The name Bruce it's short because that tweet is exactly 280 characters and we need a short name. And then there's just something about the name Bruce that's incredibly easy to get mad at. No offense to any of the Bruces out there. But that's all this was. This was a vehicle for the second half of the tweet. It was discussed earlier of, there's different things you can do, be it call to action or whatnot. This was just a health message that we just wanted to get out far and wide. When you think of the Super Bowl and football culture, I mean, my goodness, it's the antithesis of public health, right? It's large groups of people and everybody's fingers in the same bowl for foods and all that. So we asked that entire group of people at the time to please stay home and watch the game with their household. Everybody else can join via Zoom. That was a very big ask. The absolute least we could do is acknowledge it. And the absolute least we can do is politely be like, hey, thank you for doing that. We know it wasn't ideal. So all we needed was a tweet designed to be shared as widely as possible. And the way to share it is to milk the algorithm and get as many people quote retweeting and replying or commenting and sharing on Facebook and whatnot. And that's where this came from. And then it just turned into, again, having fun with it. People openly calling out what this was and us saying, yeah, that's exactly what this was. We were baiting you into replying. And then lo and behold, about a month later, Bruce had kind of become like the term of endearment of our social media accounts. Everyone knew the story. Everybody knew who he was. When case counts rose, people were replying to CTV stories saying like, Bruce better write some better tweets. And it kind of became this ongoing thing. And then we got a very wonderful DM on our Twitter account from an individual that you might know. His name is Ryan Reynolds. He's the husband of Hollywood actress Blake Lively. And he just reached out with some really kind, wonderful words for us. And we were completely floored. It was exceptionally wonderful. And then we decided, might as well ask. And we pitched the idea. And he was incredibly receptive. He was quite lovely. We wrote a script, our team, we sent the script to him. He made the video, he texted it to us. He's just like, here's the video. It's great, it's done. And it went out and became the single most successful thing we put on our accounts in the entire pandemic. And I'll make sure we put the link to the video in the chat. It was just going to eat up too much bandwidth to actually play the video for you. But my favorite part about that video to this day is that it was the first time through a really difficult time that we were able to kind of say thank you. The underlying lesson from a lot of the things that we've said over the last 15, 20 minutes here is that you really need buy-in from your audience to do what we did. You need them to get in there and comment. You need them to take ownership of your posts and share them. And everybody that followed us got to wake up on that Friday morning to Ryan Reynolds speaking to them. Like, it was the ultimate thank you gift that we can give to our followers to thank them for participating and taking part and helping make the accounts what they were. And it's my absolute favorite thing that we've ever done. And I figured it was a good place to cap this one off. Melissa, back to you.
Thank you so much. Melissa and Kevin. That was a really engaging presentation. I think I speak for everyone when I say I was chuckling all the way through it. So thank you for that. We have a few questions in the Q&A chat. We can sort of get ready to go. So the first question we have here, is there a way to understand how behavior happens offline once people engage with online comments? So whoever, Melissa or Kevin, feels best to answer that one, you can take it away and let me know if you need me to reread it.
Thanks so much for that question. Kevin, you can jump into, just so I know my video won't restart, so that's why I'm still on my photo. It just says it's not allowed. I think that's a great question, Renata, and I've been thinking about it since you posted and clarified a little bit. I can definitely see various research methods like qualitative especially, but quantitative as well, helping to understand that link a little bit more. But I guess more what I was thinking is that, you know, one single message or one single comment and reply is not going to be the be all end all. It's going to be part of like a, you know, a larger sort of more multifaceted approach. Oh, there I am. Thank you. And for me, what's really important sort of beyond sort of like monitoring what our efforts are trying to do, whether or not it's increased vaccination or, you know, have people stay at home, you know, and monitoring like COVID and wastewater or whatever it might be. I think that having negative comments and low engagement in general is sort of all kind of contributing to that undermining of the public health response, just in general, and contributing to distrust. I'm not really directly answering your question, and I know we're going to kind of connect more specifically because I think you have something in mind, but I don't know. Kevin, do you have anything else you want to add that you've specifically done?
Not entirely, no. I mean, that's always been one of the difficult parts of you know, the social media side of this is, I mean, you know, we do have other tools. We have a community outreach teams that are out there like working in community centers, and we've done, you know, online surveys and things like that. But actually getting into the nitty gritty of, okay, like, you know, people have mixed it up in the comments, but then what does that look like offline is, it's a pretty difficult space to try to measure.
Awesome. So I'm going to jump to the chat now. I think I did see a question. So this is from Chrissy. How would you approach social media now that public interest is waning, but public health still has an obligation to post and share this content? Our comments are almost entirely negative now on testing vaccine related content.
I mean, yeah, first and foremost, like, wholly solidarity to you on still being out there managing social media accounts during all this. I can speak very directly to how difficult it is. I mean, I actually took at the tail end of 2021 to 2022, I actually took about a 4.5 month leave. I burned out. I cried every day at my desk. I had to take a 4.5 month leave, saw a therapist and all that, because it's just terrible out there. But you sort of have to do a bit of a shift, right? Like, even our own messaging over the last while has shifted, you know, like, there's still some humor, but it's not as direct. We kind of approach it now because there's a good amount of fatigue. There's also a good amount of trauma, right? Like, you know, we as an entire community more or less have PTSD and we're all in a trauma response to what we've been to. So you just have to kind of cater the messaging to your audience. Yeah, you're not going to go out there writing messages like, hey, everybody, boosters are great, blah, blah, blah. But you're going to remind people, you know, here's how to get a booster if you want one. Here's the benefits of it and whatnot. And you're just kind of have to be as human as you possibly can.
I love that response. I do think, like, and you sort of echoed this in your talk, Kevin, but just really understanding people's needs and their values and being more specific and deliberate and intentional with connecting with like various communities, I think is at this point really important, so that we're not just doing that sort of like one-way push out of information, one size fits all sort of messaging. Because I think if you're getting a lot of negative response, I think it's showing it's just not matching their needs or meeting their needs. And and some more digging is probably needed.
Thank you. So this one is for Kevin from Laura. How do you work with management and internal social media approval processes to be able to be quick, to have the humor land, to have it be relevant and not making a joke 2 to 3 weeks later?
Oh goodness, lots on that one. Yeah, well, I mean, as I said, we when everything kind of kicked off with the pandemic in early 2020, we'd already had a lot of our processes in place. We started the overhaul of our social media back in the mid 2018. And for lack of any better way to put it, the know your audience approach works internally as well, right? Like we're a public health unit, so most of the people that we report to higher ups, doctors and nurses and healthcare professionals and epidemiologists and whatnot. So, for instance, the first time that we wanted to take a really humorous tack with a sexual health campaign, we genuinely wrote a book report. I mean, it was myself at the time. I was the only person on the team, but then a couple of people joined. Yeah, like I put together a 6-page research paper. I'm like, here's all the academic peer-reviewed research that's gone into why people have a difficult time approaching sexual health content, what the most effective ways to do it are, and then we worked with our internal partners. In our case, our sexual health clinic downtown, and they had their own mandates they have to achieve. X amount of free condoms given out, X amount of dental dams given out, X amount of people showing up for testing, people accessing services, all that. So we looked at the numbers from the previous 6 months, and then we kind of piloted our campaign for 6 months, and then we compared notes at the end, and we actually had about a 35% increase across the board. And so that is kind of how we slowly moved things along internally, of like, here's the evidence. Like, this isn't just out, we're not trying to go out there and crack jokes. Here's the evidence of what we're trying to do, and then here's the evidence of how effective it is after the fact. And then we did that every time we wanted to do a shift, every time we wanted to try something new, we followed that approach.
Great, thank you. Another one here for you, Kevin, from Catherine. Can you walk us through the process of writing a long thread such as sex, drugs, and Santa Claus? Is it a team effort? Did you sit with a colleague and brainstorm the 417 analogy? Is there a specific plan and goal behind each tweet?
Sure. Yeah, that one was a lot of fun. Again, you have different comms tools for different comms jobs. My colleague Nikki Hudson from the media relations team, she always says that we have a comms toolbox, and the threads are a mindset piece. There's very rarely a link in any of the threads that we wrote, or a click here to sign up, whatever. It really is just a mindset, and the goal with them always was just, we're like, here's the prevailing sentiment that we're seeing, and then here's where we need people to be. And then how can you walk somebody through that? And in the same regard as I said at the start of, like we approach social media as if it's just, regular blah, blah, blah. It was always that idea of like, picture yourself sitting face to face with somebody. How do you get them to understand it? Like, what words do you use? If words were the only tool you had, what words would you use to get them there, to help them understand it? What analogy, what way of framing or whatnot? And then write that out. And then the goal was, it would rarely be more than about 2 to 4 of us that had a hand in writing those. It would usually be a lead pen, and then people would review. And then the goal was always simple. It was, we'd take it and show it to somebody who was not in the comms team and did not know any of the context, and say, what's your takeaway from this? And if their takeaway was exactly what we said, of that walking of the logic, then it's good, and it's good to go.
Awesome. So another 2 questions for Kevin. First, we've been following you for a while up in Northwest Territory, NW, Ontario. Amazing work. Question 1, how big is your team? Question 2, can you describe the transition from stiff public health messaging to the humor-based model you use?
I mean, in the pre-COVID days, it was myself, and then throughout we grew. Summer of 2020, we grew, and there were 4 of us that maintained the Ottawa Public Health Council. So OPH has Twitter, Facebook, Instagram, and then we briefly dabbled in TikTok before all the stuff. So yeah, it was a little team of 4, and then that transition, honestly, is kind of what we said before. It was baby steps. It was baby steps internally, so that it can be walked along, and we can do this properly and show evidence and all that. But it was also baby steps on the external side, because you couldn't just one day go from being account that's just like regular government messaging to, that, because it won't be accepted naturally. So we found opportunities to engage. We found opportunities to, we had a faux Twitter feud with a radio DJ in Ottawa that lasted for like a few months and things like that. We naturally brought it along on its own, and accepted the fact that we had to play the long game. And even the account now isn't what it was a year ago, and it wasn't what it was a couple of years ago. So it's a very slow, delicate process.
And we have one final question here. What have you personally and we collectively learned from the current crisis communication response, and what can we take forward to better prepare for the next crisis? I think you can both probably answer that one.
My answer is just listen to Melissa, really. Just follow the guidebook. Like it's all there.
Thanks, Kevin. I think that echoes a comment that was in the chat as well from, oh, I lost it now. Well, there was a comment in the chat, something about the scale of our, of the pandemic, and how are we going to kind of come back from this. And interestingly, Dr. Tam was part of the keynote at the conference that I'm at and talked a little bit about that, and how, she didn't say this specifically, but I think it's continuing to demonstrate our trustworthiness, and continue to sort of build trust within our communities. And so her part of the conversation was intersectoral action, so working together across disciplines, across sectors on these complex issues like climate change, for example, and being prepared and flexible and sort of dynamic within public health, but also across our communities and the organizations that we work together with across communities to serve the population. So not just looking at like one specific issue, but being really flexible and being really, really community-based and integrated with the needs, the values of our communities. So I think that's what I would answer to that, like just continuing to do the work we're doing, but also really focusing on community-based action and partnerships, and really tailoring what we're doing to the needs and values of different communities.
Awesome. Well, thank you both so much. We're almost at time. I think we speak for everyone when we say we really appreciate you taking the time to sort of answer all the questions and helping guide us through what to do in a crisis communication. So last sort of summing up, we just want to say, are you using any evidence-informed decision-making in your practice? We want to hear from you, so email us at nccmt@mcmaster.ca. And we just have a webinar feedback poll. You should see a poll pop up soon on your screen. If you could just answer the questions on how you found today's webinar and ways we can improve, all responses will be kept anonymous. Was I muted? No, okay. The poll should have popped up now for everyone if they're able to answer. So thank you once again, everyone, for attending today. If you have any questions or concerns, you can reach us at NCCMT. Thank you to both the presenters, and I hope everyone has a lovely day.